This is Dr. Tish from Recharge Clinic, and today we're going to be doing a procedure called PRP, or platelet-rich plasma. We're going to be injecting this knee. In fact, we're going to inject both knees, but we're going to inject this knee first for kind of chronic pain, actually some ligament and tendon injuries that are in there. It has chronic pain and inflammation, and is not felt to be a surgical candidate. So this person has already tried anti-inflammatories, joint injection with steroids. So now the next logical step is to try the PRP. PRP, or platelet-rich plasma, is taken from your blood. It's spun in a centrifuge, and what it does is collect and isolate all the growth and healing factors. So the idea behind it is we're going to place these factors in the knee. It's going to help stimulate growth of his ligaments and tendons that are in there. So I'm going to demonstrate the procedure. First, we're going to prep the knee. It's always important to make sure it's nice and clean so that we don't enter any germs inside of the knee. And this is what the PRP looks like. It's a little bit kind of pinkish tinged. It has a couple of red blood cells in it, but it's mostly just a clear fluid. Find the joint space. We're going to go ahead and inject into that spot, and that's all we do, is we just put the PRP right on in. And what we're going to do is go ahead and move the knee all around after we're done to make sure it kind of goes all around, and that's it. The only real limitations with this is that we will restrict the use of anti-inflammatories like Motrin or Aleve for about 2 weeks. And that's it, and we'll reevaluate him in 4 weeks.